So let's say you squat down, feel good, you squat coming back up, feels good. So during the workout, everything feels pretty good. Let's say it's maybe later that day or the next couple days after, your back's kind of crabbing at you because every time I squat, my back hurts. So this is a little bit different. It's typically more muscular in nature, meaning that it could be technique. All the things we talked about, from the things that you could do sort of on the way down, things you could do on the way back up. All those things absolutely pertain to contributing to this part as well. But now you're looking at the volume, right? So sets and reps, how much weight you're using. Those things now become bigger factors too, because soreness typically comes from volume, right? If you do 5 squats, even with a heavy load, you're probably not going to be that sore. But if you do 50 squats with a decent load, there's a very good chance that you're going to be sore, not in a bad way, just generally speaking. So volume is typically what makes people sore. So when things are sore afterwards, we look at, all right, well, how much am I doing, and then how am I doing it, right? Because it comes down to technique and also the type of squat you're doing. If you're forcing yourself to do barbell back squats with a straight bar, that could be part of your problem. We're going to talk about setup in the next video, but sometimes it's not the squat, it's the type of squat. Not that squatting's bad, but maybe for you the straight bar is not good. Maybe a yoke bar or a safety bar that has the handles out front, maybe that's better for you. Maybe goblet squats, maybe front squats. Maybe try a different type of squat to help alleviate some of the pain afterwards. Maybe cut back your volume a little bit, right? If your legs aren't that sore, but your spine is kind of sore and your back is hurting, something's not right there. Most of the work should be done through the legs, quads, glutes. Now, here's the thing though, you do have muscles in your low back and all along the spine. So yes, they do get worked and some minor tightness once in a while, not a horrible thing. But if it's pretty consistent, like every time you squat, you feel your back afterwards, then that's not a coincidence. That means there's something you're doing, whether it's the type of squat you're doing, the sets and reps, the weight, the overall volume, something has to be addressed. Maybe in addition to some of the other things we've already touched upon in terms of the transition from the bottom to the top, those kind of things. But take a look at those things and really kind of break down what you're doing, but understand that chronic pain afterwards in the low back with squatting is not normal, it's not okay, it's something that you definitely want to address.